Do you get kneecap pain walking upstairs? Walking upstairs is one of the most painful things for people with kneecap arthritis. And kneecap arthritis may go by many different names, such as patellofemoral degenerative arthritis, chondromalacia patella, patellofemoral pain, or just garden variety kneecap pain. But if you get kneecap pain when you're going upstairs, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what causes pain behind the kneecap when you're going upstairs and during other exercises or activities, what causes pain above and below the kneecap, and why some common treatments for knee arthritis, even joint replacements, don't necessarily work for people who have kneecap arthritis. So first of all, what are the things that cause kneecap arthritis? Well, if you look at an x-ray, and particularly what's called a sunrise view of an x-ray, you'll see decreased joint space, not in the sides of the joint, but in the space between the kneecap and the thigh bone or the femur. Now, furthermore, if you have a knee replacement, they don't replace your kneecap. Sometimes they will resurface the back side of it, but they replace the femur and the tibia. So if the pain is truly coming from your kneecap, you may not necessarily need a joint replacement, even if you do have kneecap arthritis. Now, the things that typically cause kneecap arthritis to hurt when you're going up and down stairs are stiffness in your thigh muscles, overuse of your quadricep muscles, or sometimes stiffness of a tendon on the outside part of your knee called the IT band. And so let's first address that IT band, since I'm already facing toward you this way. When you go upstairs, if you have weakness in your hip muscles and your knee goes inwards, it causes the femur to move in this way, but the IT band, a long tendon that runs down the outside of your thigh, it has some attachments into the kneecap. And so it'll pull the kneecap sideways. And you can even see that on that sunrise view of the kneecap. You'll see sometimes the kneecap will start to squint out to the side. And so if you notice you're getting more pressure, particularly on the outer side of your kneecap, then it's likely a side-to-side issue where that IT band is pulling the patella laterally as the femur is going inwards. And so if you have that type of problem when you're going upstairs or when you're squatting where your knees are going together, then paying attention to keeping your knee turned slightly outwards when you're going up the stairs can help quite a bit. So if you allow your knee to go inwards, it'll create compression on that outer side of the kneecap, versus if you think about turning your knee outwards, and realistically, you're probably not turning it out quite that much, but if you think about turning it outwards and you have a tendency to go inwards, you'll probably end up with it just about in the right spot. So that's the first tip if you have kneecap arthritis, particularly that hurts on the outside part of the knee when you're going upstairs or when you're squatting. Now, the front to back problem is often more problematic for people with kneecap arthritis. And you may notice this when going upstairs. You may also notice that you get kneecap pain when you're sitting in a chair with your knee bent for a long period of time, or if you're sleeping on your side and you get kneecap pain at night when you're sleeping with your knees bent. You may have some stiffness in your quadricep muscles. And when you have stiffness in your quadricep muscles, it creates more compression of your kneecap up against your thigh bone. And that's because your kneecap actually sits inside the tendon of your quadricep muscles. Now, likewise, if you have stiff quadricep muscles, or if you overuse your quadricep muscles instead of using your glutes when you're going upstairs or when you're squatting, you may notice tendinous pain, either kneecap pain above the knee or kneecap pain below the knee. And that's more of a tendinous problem, but you do kind of feel like it's coming from your kneecap. Sometimes you can actually develop bone spurs that will develop, particularly above the kneecap, and you can see those sometimes on an x-ray where there's a little piece of bone above where it looks like the kneecap should be. And so if you see that on your x-ray, or if you're feeling kneecap pain above the knee, that's a sign that you're overusing your quadriceps when you're going upstairs or when you're squatting. And so if you have that problem, here's what you do for it. So as you're going upstairs, you want to make sure to place your whole foot on the step, or as much of your foot as you're able to if you can't fit your whole foot. And that's because when you put more pressure on your toes, it's a very quad dominant exercise where you're using your thigh muscles or your quadriceps to extend your knee. The axis of motion is more here as you're going up, and you're using your thigh muscles to bring you up the stair. Versus if you can get your whole foot and push more through your heels, you can make it more of a hip extension motion by using your glute muscles. And when you use more of your glute muscles, it allows you to use less of your thigh muscles. So put your whole foot on the stair. Again, turn out a little bit or think about turning out so that you don't get too much of that side-to-side motion, and then push through the heel. Now, another tip that will help you is that if you're trying to bring your center of gravity from here to there to get up the stair, it's a lot longer lever arm on your thigh from your center of gravity to the axis of rotation of the knee, versus if you lean forward a little bit, almost lean into the slope of the stair, that brings your center of gravity closer to the knee joint. And if you do that, you can see I'm already kind of starting to go up the stair without really using too much effort out of my muscles. It's just kind of leverage. So combining those tips, turning the knee out, leaning slightly forward to get the center of gravity closer to my foot, having my whole foot on the stair, and then pushing through the heel using my glutes. That uses a lot less thigh muscles and creates less compression on the kneecap or the patellofemoral joint. So again, if you have patellofemoral arthritis or kneecap arthritis and you have pain going upstairs, getting your whole foot on the stair, pushing through your heel while leaning forwards and turning your knee out will help you to be able to go up the stairs with less pain. Now, eventually you do want to address the things that are causing that compression in the first place. So you want to strengthen your glute muscles, and a great way to do that is just by practicing going upstairs the way I mentioned, or going upstairs sideways where you're pressing up and down like that. And doing step-ups or lateral step-ups are a great way to strengthen your glutes, along with doing partial lunges. And again, you want to think about keeping your knee turned out when you're doing those partial lunges. But there's also the stiffness component. If your quadricep muscles are too stiff, then that's going to create more compression on your knee joint. And because your patella lies inside that quadricep muscle, the more you bend your knee when you're going upstairs, or the deeper you squat, or the longer you sit with your knee bent, the more compression there's going to be. And so you want more flexibility or extensibility of the thigh muscles. Now, just stretching your quadricep muscles isn't necessarily a great thing for people who have kneecap arthritis, because if they're stiff and then you go to stretch them, it creates more compression underneath the kneecap. So it is helpful to do some things to help loosen up the muscles and increase their extensibility before you start stretching. And one great way to do that is just using a massage stick and rolling it up and down your thigh like this, and kind of get along the inner side of the knee and the outer side. Again, your quadriceps means 4 heads. So it's got a lateral head, a medial head, and then 2 heads that kind of run down the middle. And so massaging on all parts of the quadricep muscle. You can even go on the outer side where it joins with the IT band. And doing that to get the quadricep a little bit loosened up before you start stretching. And there are a couple ways to stretch your quads, but one really important point is you don't want to stretch aggressively when you have kneecap arthritis, because when you start stretching too hard, that just increases the compression force behind your kneecap. So one way to do it is just to do an active stretch, where you stand holding on to something and then bend your knee just through the range that feels easy to do. And if you bend your knee just through what feels easy to do, you're not going to create excessive compression on your kneecap. Now notice you should be able to keep your hip and your lower back fairly still. If you go beyond what feels easy, you start to get your heel up higher. If you're really trying to pull it up towards your bottom, then if you've got stiffness in your thighs, you're going to get a lot of arch in your lower back, which isn't necessarily good for your back. If you also happen to have back problems, it also doesn't really help increase the extensibility of your thigh muscles and creates more compression behind your kneecap. So just do what feels easy to do and do lots and lots and lots of repetitions. 30 repetitions plus, but they should be easy repetitions. And over time, as the muscles get warmed up and loosened up, you can go a little bit farther without really having to stretch hard or work at it. Now, another option, if you've got enough flexibility and enough balance, is just to put your foot up like that, and then just hold that for a gentle stretch. And again, this shouldn't be an aggressive stretch. And then if you need to get a little bit deeper into the stretch, you can just move a little bit more forwards. Now, if you don't have this much flexibility in your knee, or you don't have the balance to stay and do this, even if you're leaning on a wall, I've got another video that shows 7 different ways that you can stretch your quadricep muscles. And I'll link to that somewhere either in the description or on this page, depending on where you're watching the video. So that's another tip to help improve the flexibility of your quadricep muscles. So just to review, if you do have kneecap arthritis, particularly when you're going upstairs, then you want to make sure to get your whole foot on the stair, turn the kneecap out slightly, so just to review, if you do have kneecap arthritis, particularly when you're walking upstairs, you want to put your whole foot on the stair, turn the knee out slightly, lean your trunk forwards to get your center of gravity closer to your knee, push through your heel so that you activate your glutes, and then go up. And almost think about stepping through to the next step if you're actually going upstairs. Rather than going straight up, think about stepping through to the next step. And then to help increase your glutes, doing step ups either sideways on a stair or forwards on a stair, again pressing through your heel, or doing lunges is a great way to help strengthen your glutes. Rolling with a massage stick to help loosen up the thigh muscles, and then doing gentle stretches by bending the knee or stretching with your foot up on a chair are all great things you can do if you do have kneecap arthritis, patellofemoral, degenerative arthritis, patellofemoral pain, or chondromalacia patella. So hopefully you did find this video helpful. Now, if you are in the St. Louis area and you need more help for kneecap pain or kneecap arthritis, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.